Good afternoon, everyone. I'm Nirav Shah, the director of the Maine CDC, and I am joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to be with you today to talk about where we stand with respect to COVID-19 for today, Wednesday, October 13th, 2021. I'll start off by providing an epidemiological update and then turn things over to Commissioner Wambrew before we turn to our colleagues in the media for some questions. Before we get to the numbers today, I wanted to take a second to note that today is the 200th media briefing since the beginning of the COVID-19 pandemic. None of us thought that we would be here today where we are, but yet throughout the pandemic, we remain here even though we are starting to see some signs of easing. Now, to those of you who have tuned in to these briefings since the beginning, we'd like to take a second to thank you. You have spent the equivalent of 8.3 days with us throughout this pandemic, hearing about the latest with respect to COVID-19. There have been a number of other folks who have been with us since those first days throughout all 200 briefings now. For example, our interpreters, Josh Seal, who's here with us today, and Dr. Reagan Thibodeau. They too have been with us since the very first such briefings. And I'd like to thank them as well for spending 8 1/3 of their days with us over the past 20 months to ensure that these briefings are as accessible as they can be to as many Maine people as possible. I'd also like to take another second to thank Maine Public for streaming and archiving these discussions, and to thank the entire team statewide of individuals who are working on COVID-19. Commissioner Wambrew and I are just two of a cast of thousands of people across the state who are working 24 hours a day, 7 days a week to ensure the safety of Maine people during this historic pandemic. I'd also like to take a second to thank and shine a spotlight on the numerous community level groups across the state who have, since even before the first case of COVID was detected, been doing the hard work on a daily basis to keep people in Maine safe, healthy, and more recently, vaccinated. Groups like the Immigrant Resource Center of Maine, the Maine Immigrant Rights Coalition, our colleagues at Maine Mobile Health, Catholic Charities, and a host of other groups across the state are working with Mainers day in and day out to keep them safe, healthy, and vaccinated. And of course, I'd like to thank all of you who have spent your days and your evenings watching, tuning in, and hearing the latest. We very much appreciate your partnership throughout this process. Now, on to the latest with respect to COVID-19. And there, I begin with some sad news. Maine CDC is reporting 7 additional COVID-19 related deaths today. One was a resident of Cumberland County, another a resident of Kennebec County, 2 who were residents of Penobscot County, and 2 who were residents of Somerset County, and finally 1 who was a resident of York County. 3 of these individuals were women and 4 were men. 3 were between the ages of 70 and 79, and 4 were in their 80s. Overall, these 7 additional deaths bring the total number of deaths associated with COVID-19 in the state of Maine to now 1,083. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of those who have been affected. Statewide, there are now a total of 95,833 cases of COVID-19 statewide. Represents an increase of 893 cases since this weekend. Cumulatively, there have now been 2,614 hospitalizations associated with COVID-19. And throughout the pandemic, there have been at least 6,516 individuals who are identified as healthcare workers who have been affected by COVID-19. In terms of hospitalizations, there are right now 168 people in Maine hospitals associated with COVID-19. 1 week ago, that number stood at 166. Right now, 60 individuals are in the critical care unit with COVID-19. And 1 week ago, that number was at 51. Similarly, there are now 29 people on a ventilator in Maine. 1 week ago, that number stood at 21. Statewide, there are 42 available critical care unit beds. Now, in terms of testing, our 7-day PCR positivity rate in Maine stands at 5.2%. And our PCR testing volume on a 7-day average basis now stands at 416 PCR tests for every 100,000 people in Maine. And turning now to an update on vaccines and vaccinations. Overall, as a state, Maine is currently administering 4,008 doses per day, a 48% increase in vaccination rates over the past 2 weeks. But that global increase in vaccination rates has some moving pieces behind it that bear a little bit of unpacking. First doses, for example, are down just a little bit, from 825 first doses a day to 739 over the past 14 days. But second doses are up, quite considerably, in fact, going from 577 per day to now 1,241, almost a doubling of second doses. Now, third doses continue to account for the large fraction of shots that are being given. Right now, Maine is administering about 2,470 third doses per day over the past 17 days. What does all this mean on a population level? Well, about 69.1% of the entire state of Maine, for every single person in the state, about 69.1% of the entire state is now fully vaccinated. And 75%, 3 out of every 4 Mainers that you meet on the street, have had at least their first dose. When we look at just adults who are 18 and over, 80% are fully vaccinated and 86.5% have had their first dose. And now let's zero in on Mainers 65 and older. 93.8%, almost 94% of Mainers 65 and older are fully vaccinated. And across the state, according to the US CDC, 99.9% of all Mainers over the age of 65 have had at least 1 dose of COVID-19 vaccine, 99.9%. We've made tremendous, striking progress on vaccines, but of course, we've got more to do. Something I'm sure we'll talk about as we talk with our colleagues in the media. But before we do, I'd like to turn things over to Commissioner Lambert.
Thank you. Today, the Maine Department of Health and Human Services updated its monthly dashboard of COVID-19 vaccination rates among Maine healthcare workers. Healthcare worker vaccination rates rose rapidly in September, further protecting those frontline workers, the health and lives of people in their care, as well as safeguarding Maine's healthcare capacity. Specifically, between September 1st and September 30th, rates climbed above 90% for hospitals and ambulatory surgical centers. Rates also rose significantly in nursing homes, going from 77.2% to 85.8%. For comparison, as Director Shah said, 80% of Maine adults are fully vaccinated as of October 12th, and only 67.9% of all adults in the United States. We are excited by this progress, and we continue to urge all Maine residents to get vaccinated. It's the best and most effective tool we have to keep our health system strong and turn the tide on the pandemic. With that, I'll turn it back over to you, Director Shah, for questions.
Great, thank you, Commissioner. For our colleagues in the media, we have 15 members of the media today who are queued up to ask a question. Commissioner Lambert and I have until 3 p.m. today. So I'd ask that you please be respectful of your media colleagues so that everyone can get their questions in. So with that, the first question for the afternoon goes to Rebecca Howland from Brunswick News.
Hi, can you hear me okay?
We sure can, Rebecca. Go ahead.
Wonderful. Well, thank you for taking my question. I am across the border here in Woodstock, New Brunswick, and I was really curious to know, with the states set to open its border to land travelers from New Brunswick and other borders, are you concerned about an increase about potential cases? And will contact tracing of Canadian travelers, will that be a challenge as well?
Sure. Thanks, Rebecca. I can start, but Commissioner Lambert and I, both something that we've discussed. As of right now, the U.S. government, which ultimately makes those decisions, has not indicated when the border will be reopened to Canadians who wish to come into the United States. Certainly, that opening will be a great relief to those who are waiting to see their friends and their loved ones from Canada. What we've seen throughout the pandemic is that border crossings of that sort, whether it's from other states or even internationally, can and have been done safely. For example, one of the requirements will be that an individual from Canada who is coming across the border to the States will have to be fully vaccinated. We've seen that requirement in and of itself greatly reduces the likelihood of transmission. So I think, although of course we're always concerned anytime that there's any movement, because that is fundamentally how pandemics spread, because of the high vaccination rates in Maine, as well as the high vaccination rates among you and your colleagues across the border, that sort of travel can be done safely. And of course, we know how important it will be, particularly for our border communities, to be able to resume those normal rhythms of daily life again.
Wonderful. Thank you very much.
Thanks, Rebecca. Let me go to Emily Bader from the Sun Journal next.
Hi, good afternoon. I want to touch upon Central Maine Medical Center. So thanks for calling on me first before my colleagues beat me to it. So yesterday, Governor Mills sent out a press release saying that she has directed the Department of Health and Human Services to continue working with CMMC to support critical health services. So I'm hoping you or Commissioner Lambert can expand upon what that means. And then because it seems like both sides are kind of holding out, the state saying we're keeping this requirement and these healthcare workers presumably are not getting vaccinated, what happens if both sides, continue to hold their positions?
Sure. Thank you, Emily. I think I'll begin by talking about vaccination requirements. Like the American Hospital Association, the Maine Hospital Association, other hospitals across the state, as well as the Nursing Facility Organization, this administration continues to believe that it is imperative that healthcare workers have the best protection against COVID-19 for themselves as well as their patients, and that is vaccination. We have had literally dozens of outbreaks in healthcare facilities, over 300, as well as seeing thousands of healthcare workers test positive for this dangerous and highly transmissible disease. This is why the federal government has announced its own vaccination requirement for healthcare workers that will be issued this month. As a senior clinician has said in Maine, it is the virus, not the vaccination, that is causing our stress at our hospitals and our facilities. The best thing we can do against that virus is vaccination. And turning to our work with Central Maine Medical Center, throughout the pandemic, the governor's office, Department of Health and Human Services, our colleagues have held regular calls, often weekly calls, with our hospital leadership, including Central Maine Healthcare, to see what do they need. Is it testing supplies? Is it PPE? Are you having staffing problems? And what can we do? We recently have been meeting with Central Maine Healthcare on its issues, which are not necessarily caused by either an outbreak at the hospital or a large number of COVID-19 cases. It is this wear that we've seen on our healthcare system during the pandemic, but also before the pandemic. We've had healthcare shortage issues in Maine for too many years. But in the short run, we are, first of all, providing technical assistance on staff flexibility, different sources of workers and trainees, and other ways to preserve access to services. We provided $25 million last summer, including over $1 million to Central Maine Healthcare for COVID relief. We're doing another round of payments this month, $146 million going to hospitals and nursing facilities, including Central Maine Healthcare. And we also put into the Maine Jobs and Recovery Plan at the governor's behest nearly $20 million for this short and long-term healthcare workforce, challenges. We get it. We know that there are challenges in healthcare workers staying on the job. It's been a long 19 months, but we believe that vaccination is the best way to keep those workers safe and healthy as well as on the job. And in the meantime, we're going to work night and day on how do we really work with our healthcare partners to keep our capacity up.
Thanks, Emily. I'm going to move to Megan at WMTW next.
Thanks for taking my question. I'm just going to kind of build on what Emily asked. For those who maybe have CMMC as their local hospital, I'm hearing all of the resources that you guys have, or the state has made available to them. But let's say you're somebody who lives in that community and that might be your local hospital. If you're weighing public health crises, would this seem like a public health crisis for somebody who that might be their local hospital and they're super concerned about what if I need critical care? What do you tell them? Because millions of dollars and, healthcare shortages, okay, worker shortages, but, if someone's using the hospital, what's your message to them?
I'm going to repeat, we're working with Central Maine Medical Center as we speak to try to figure out if we can help. Can we look at regional resources? Are there additional staff that we can help them bring on board? We're working with the hospital directly. We also are working with the regional hospitals to make sure that there is capacity. St. Mary's, for example, has put out its own statement talking about its capacity and its ability to help. It is in the Lewis and Auburn area. We are looking at regional resources. We are going to do what we can to preserve access to healthcare for people in Maine, and that is by directly working with the hospital to figure out why it has shortages and how we can help, but also looking at our regional resources. That will be done on a daily basis. We always are committed to trying to protect access to people and access to healthcare for people, but especially right now in Central Maine.
If I could just quickly follow up, earlier on in the pandemic, we had talked about how, if you have another health issue that you don't think is COVID, do not wait to go to a hospital, and if you're hearing that maybe they're not as, intake, they can't take on as many patients, and that theoretically might, prohibit someone from seeking immediate health care or medical care that they might need. I just wanted to ask you again, if that same message is there, that, don't put it off, even though there might seem like a shortage. Excuse me, sorry.
Sure. No, I'm sorry. And I just want to say, I think we have to remember that part of the reason why we have this stress in our healthcare system is because while there is a vaccine that is safe and effective, we have high rates of vaccination, but not enough people have gotten vaccinated. We have had, as you recently reported, a record high number of people in critical care during the Delta surge. We've had a record high number of people in hospitals during the Delta surge, and that has created stress on our healthcare system, large risk. So again, going back to basics, we are fortunate to have scientists who have developed this amazing set of vaccines that work. And I think now trying to get more people to get those vaccines will keep people out of the critical care and intensive care units, keep our healthcare workers safe, and have their own stress in their daily lives be lessened by having a more healthy population. Thank you.
Megan, the advice remains, if you are in need of healthcare, do not delay seeking it. And that's why I think the statement that the commissioner referenced from St. Mary's, where St. Mary's has signaled their ability to assist with the situation and assist in that area, is really critical.
Thanks.
Thanks, Megan. Patrick, over to you.
Thank you very much. So sort of piggybacking on the same subject, federal court judge today decided not to intervene to stop the governor's requirement that health workers be vaccinated by the end of the month, or by close to the end of the month. I'm curious if either of you have heard that yet, since it happened within the hour, I think, and if the department has a statement on it.
Yep, I do believe that the governor's office will be issuing a statement on this. I think we welcome the decision. We think that our rule was carefully considered and executed. We always strive to use the tools that we have that are available to us. And this immunization rule that we've had is longstanding, decades old, because people have for a long time, back to George Washington, actually recognized the value of vaccination in keeping people on the front line safe.
Thanks, Patrick.
Just wanted to throw out one more thing, which I think is pretty concise. The US CDC has said to expect over the coming weeks for daily caseload to trend downward, which we are seeing in most states and are possibly, fingers crossed, beginning to see in the state of Maine. The daily caseload is down a bit over the last 2 weeks. Is that what you expect to see here, or what are the trend lines in the state?
I can't predict what direction things will go, if they will continue at the rate that they are, if they will, as we hope, they might take a downward turn, or heaven forbid they go in the opposite direction because the virus discovers a new pocket of unvaccinated individuals to infect. Certainly, we're encouraged by the data from other states where there have been a downturn. There are some very early signs of an easing here in Maine. But as I noted, hospitalization rates, for example, are largely where they were a week ago. And on some metrics like ICU and ventilator usage, even higher than they were a week ago. So it's too early to tell. They're hopeful signs, but we won't really know until we have even several more days of data.
Good to know. Thank you.
Yep, thanks, Patrick. Let me go to Annie from Spectrum News next.
Hi, thanks so much for taking my question. I want to ask about a study that came out this week from the University of British Columbia, which found that places in the US that reopened their schools for in-person learning last year saw at least a 5% increase in COVID cases as a result, and that increase was greater in places that didn't require school staff to wear masks. The researchers say it supports the need for more mask and vaccine requirements in schools, and I just wanted to know if, given findings like this, if Maine still thinks it's on the right track with COVID cases in schools without new mandates.
Sure. Annie, sorry, Commissioner, go ahead.
Well, I was just going to say, the same way that we have a monthly vaccination report for healthcare workers, we also have one for school staff to really track what's going on with the vaccination of school staff. We do expect to post that next week. We are also gathering information on how many of our schools and school districts have adopted a universal mask policy for their schools. We look forward to seeing that information so we can do our own assessment of what's going on here in Maine. We do know anecdotally that many of our school districts have adopted a universal mask policy. We are going to, again, try to figure out exactly where that has not happened, what's going on, and work with those schools, because we do know that the most effective policies are the ones that are adopted by those school leaders, by those superintendents, by those school boards. So we will continue to work with our schools to keep kids, school staff, and teachers as safe as possible.
Annie, I'm familiar with the paper that you reference. It as with so many epidemiological studies, it does draw a correlation between two events, but the causation, as the authors themselves acknowledge, is not 100% clear. It's possible, theoretically possible, that schools were the source of transmission. It's also possible that places with higher community transmission had higher rates of detection because of testing in the school. So in and of itself, the paper didn't really answer that fundamental question of where the causation is occurring. That being said, with the Delta variant being more transmissible across all settings, we are prepared for the likelihood that there will be transmission in school. And that's why we've been rolling out initiatives like pooled testing and other such things to try to spot those increases before they go too high. Let me go to Amy Brown next.
Thank you, Dr. Shah and Commissioner Lambrou. A spokesperson for Northern Light Health said earlier today that 95.5% of their workers have received vaccines, and that the rates are highest among the staff with the most medical training, which is what we've been hearing. They say they don't anticipate any interruption in services, even if the remaining 4.5% decide to leave, as contrasted with the situation at CMMC. So I'm wondering if you have a sense of throughout the state where most of the larger healthcare facilities fall on that spectrum? Do you think most are going to be more like Northern Light Health and be able to, have plans in place and continue to function without diverting people and postponing surgeries? Or will they be closer to CMMC? You probably have some idea of like what's in store for some of the other places.
Sure. So, we've been working with our healthcare organizations throughout the pandemic, including on our vaccination efforts. We appreciate that, in some places there are greater challenges than others. All that said, our healthcare system here in the state of Maine is first class, high quality. People have planned for all sorts of disasters, be it a pandemic or a snowstorm or a flood or other types of emergencies. So they are used to planning for the short run and the long run. We feel confident, as does the Maine Hospital Association, as does Northern Light Health and Maine Health and many of our hospitals. I think you all have heard that Millinocket Regional Hospital, for example, hit 100% back in September, and they are in a rural area of the state where there is relatively low vaccination rate. So it is possible. We should just recognize it is possible to fully vaccinate healthcare workers against a communicable disease and not have critical staff shortages. All that said, we will always work with a facility that is struggling with staff, because our obligation here at the department here in the state of Maine is to help sustain services for Maine people. So we will continue to work with facilities that need any sort of assistance that we can offer, as well as identify those best practices where we have seen evidence that workers can be both safe and hospital capacity can continue.
So you're not anticipating any widespread service disruption across the state?
We are not anticipating any widespread service disruption across the state.
Okay, and I think this is a quick question. If not, we can put it off till next time. But Dr. Shah, I think this is more for you. There have been some predictions that this flu season may be very severe, and I'm wondering how that is predicted and if you agree.
Okay. The way that we anticipate what a flu season might look like, or at least have an inkling, is based on the experience of Southern Hemispheric countries with their own flu, because the way that flu patterns are, flu emerges in the Southern Hemisphere, works its way to the Northern Hemisphere. Sometimes those predictions are spot on and we mirror the South. Other times they're not. The concern is that because last year's flu season was effectively nil because of the measures people were taking to keep themselves safe from COVID, largely because of those measures, the immunity that may have been residual amongst populations may not be there. And so there's heightened concern for this flu season. The bottom line, Amy, is as with so many things pandemic related, we don't know what the future will bring, but there are reasons to be concerned. But there are equivalent reasons to take steps to protect yourself, namely to go get your flu shot. This is a great time of the year to go get your flu shot. They are widely available across the state of Maine. And so if you're looking for something to do today to keep yourself healthy throughout the winter and the fall, go get your flu shot.
Thank you.
Thanks, Amy. Let me go to Meyer next.
All right. Thank you, Dr. Shah. I know the administration has cited the forthcoming federal vaccine requirement as one of the reasons why it didn't make sense to change the vaccine mandate. Why not just delay enforcement further until those federal rules are finalized?
Sure. So I think it's important to recognize that we have always striven to use the information that we have from research, from on the ground activity in Maine to figure out what's best for Maine residents, Maine businesses, and our healthcare sector. I think it became obvious to us that when we were beginning to see how this vaccine works and how hard the healthcare sector has been hit by COVID-19, that it was an imperative for us to move forward. There was a fair amount of time when we first announced this in August 12th for facilities to work with their workforce to get them fully vaccinated by basic October 1st. We decided to allow another 4 weeks to have those facilities have that little extra time to work with those workers to see if they could convince them to get vaccinated for their own good, the good of their patients, the good of their facilities. But that time is up. We do anticipate that the Center for Medicare and Medicaid Services will be issuing its own rule in the coming days. We expect it'll be similar to the rule that we have, but with the number of cases of healthcare workers in Maine who've gotten COVID-19, we didn't think we could wait.
And then I guess, Dr. Shah, you've talked a little bit about this in the past, but and I know that other people have left for other reasons besides a vaccine mandate, just a toll of the pandemic being in healthcare. But there are a number of healthcare workers who have decided to leave their positions because of the mandate. What do you say to those workers?
Well, I'm happy to answer that, Mel. I just want to build on what Commissioner Wambrew noted. I noted as I was going through the numbers today, we've had at least 6,516 individuals in Maine who are COVID positive and who are identified as healthcare workers. Simply put, to your prior question, waiting could cost lives. That's the bottom line. In terms of healthcare workers who have left the profession, they each have their own individual reasons, and the fact that they have elected to leave doesn't mean that they will always be out of the healthcare system. They may find their way back, particularly if they choose to get vaccinated. But this was a condition of employment, not a mandate. And so you're right, there are folks that will elect to leave healthcare altogether. I wish they wouldn't, because Maine people need them right now. And so I wish those folks would decide to get vaccinated and come back into the healthcare fold. But I also understand that people make decisions and they've got to do what's best for them. Even though I respectfully disagree with the decision not to get vaccinated if you're a healthcare worker, that is something that, of course, they can decide to do.
Thank you.
Thanks, Mel. Let me go to Allegra from WABI.
Hi, Dr. Shah. I was wondering if there is any data that is showing that if and when that younger sort of 5 to 11-year-old range is eligible for the vaccine, if there's any data that shows that will significantly sort of curb the spread of the virus, or if we're still going to be looking at those older adults that are just not getting vaccinated as the root of the problem.
Okay. Wow, Allegra, that's a great question. I'm going to answer in a quick second. I want to just go back to Mal Meyer's question. Mal, I should have said, and I will add on to my prior response. It's not just healthcare workers. This is an ongoing discussion with everyone in Maine who hasn't yet been vaccinated. And whether you're a healthcare worker or not a healthcare worker, it's going to be an ongoing discussion with folks who have not yet chosen to get vaccinated. And my office, Commissioner Wambrew, we are committed to remaining involved in that conversation. So I just wanted to be clear on that. We're not shutting the door on them. We are here for them anytime they want to get vaccinated or get their questions answered. Allegra, to your question, in many respects, this is one of the key questions with respect to pediatric vaccination. The early data that have been submitted by Pfizer suggests that the vaccine will raise or boost or increase the antibody rates in children aged 5 to 11. And we thus extrapolate from that they will be protected themselves on an individual level from getting COVID-19, having to be hospitalized. But I anticipate a key component of the discussion, both before FDA as well as before the US CDC, will be the extent to which vaccinating children, those aged 5 to 11, will not just keep them safe, but also keep others safe. Now, there are some scenarios where we can pretty clearly see where it would. A 6-year-old who wants to visit her grandmother. If that 6-year-old's vaccinated and the grandmother is vaccinated, that interaction is that much safer. But what will it mean on a population level? Well, for that, you really have to get into the guts of a lot of mathematical models. That's what the FDA and the CDC do really well. I'm awaiting to see what their analysis will be. I think there's good reason to think that vaccinating another 80,000 people in Maine, which is the number of individuals in Maine between the ages of 5 to 11, will help us bend the curve even lower. But the extent of that, how much lower it will help us get, that's an open question. It's a great question, Allegra. I'm eager to hear the analysis from our colleagues at the FDA and the CDC.
Great, thank you so much.
Mm-hmm. Let me go over to Evan Popp next.
Hey, Dr. Shah, thank you. In a story last week about an outbreak at Cumberland County Jail, it was reported that the vaccine rate for staff and inmates at the jail was about 50%, which is pretty far below the state and county average. Do you have a sense of what the reason for that disparity there might be? And have you seen similar disparities in vaccine rates in county jails versus the rates in the corresponding counties?
Thanks, Evan. I can start, and Commissioner, please weigh in. Evan, I've seen that number as well. I don't have a comparator against which to benchmark it in other county jails. I understand from my colleagues at the Department of Corrections that number at the jail level is lower than what our colleagues at DOC have seen amongst correctional officers in state facilities. But to your fundamental question about why that may be, Evan, I don't have a good sense and would hesitate to speculate. I'm really not sure. I think Sheriff Joyce may have better insights than I would.
And overall, just kind of a quick follow-up question. I'm wondering if you can talk a little bit about the state's kind of strategies for getting more people in jails and more corrections officers vaccinated. And does that differ at all based on like the setting, if it's prisons versus jails?
I can start, but again, Commissioner, please weigh in. We, as you know, Evan, we talk with DOC and our DOC colleagues literally every day to touch base on what the status of things is with respect to COVID-19 in jails, as well as state-run correctional facilities. We are not pulling back at all in terms of getting more folks vaccinated in all correctional facilities, both residents as well as employees. For example, when we were thinking about boosters and such things, we're actively working with them to make sure that those are available. Our strategy doesn't differ by whether it's a jail, a state prison, et cetera. It's really about making sure that they've got the facts they need and then the access. So, for example, making sure that if corrections officers, to say nothing of residents, aren't able to go elsewhere for their vaccine, we're bringing vaccines to them through their in-house medical providers, things of that nature. We haven't pulled back, and indeed, as we think about the next wave of vaccines coming down the pike, we're really looking at how we can redouble those efforts.
And I'll just quickly add that we do work with Maine Municipal Association, which it does provide information to all of our county officials. We also did just remind our county and local officials that the American Rescue Plan does provide over $100 million to municipal governments for COVID-related activities. So we do hope that our municipalities look at the new opportunities that are out there, including sources of funding that can help with activities such as vaccinating their jail workers as well as other municipal employees.
Thank you.
Thanks, Evan. Let me go to Rebecca from News Center next.
Hi, good afternoon. Being mindful of time, I have two questions. One I think will be quick. With enforcement of the vaccine mandate rolling in at the end of the month, how are we preparing for that phase, and what will enforcement look like?
Sure. So we anticipate that the survey that we've been doing since June, monthly of certain healthcare facilities, will end at the end of the month. We'll use the October survey to work with facilities to bring them into compliance. We will then make that monthly survey into an annual report, which will be submitted every December as the regulations require, and do the kind of compliance activity that we typically do with these sorts of requirements. That includes complaint-driven investigations as needed, random audits to check records to see if there is compliance, as well as, again, a good dose of working with organizations to understand what are the barriers and what we can do to help bring them down. So we are anticipating that phase coming up and put a little bit of that information into our press release today on the monthly survey.
Okay, great. Thanks. My next question, it's not really data-driven, but more general advice, I would say, around mental health and, quite frankly, our inability to predict the end of the pandemic. It's actually timely that you mentioned that this is the 200th briefing. I think that many people listening in on this call, maybe even all 200, are the very same people who have been listening to all the public health guidelines and wearing the mask and keeping distance, quarantining, getting vaccinated, all of it. And even if you could abracadabra the pandemic to end today, I think many of these same people will carry the lessons with them. Wear a mask if they're not feeling well. Get the annual flu vaccine. But I would say, or we've heard rather, it's these very same people who are getting weary mentally, who are growing frustrated and maybe even bitter or resentful towards people who they think aren't doing their fair share over the last 19 months. We spend a lot of time talking about how to get hesitant people on board, but what about the people who are listening, who have been diligent? What can you say to them to help improve the mental state there and ease the exhaustion, the frustration, and maybe even anger?
Yeah, and I'll just begin by saying we hear it. I mean, when we think about what is the challenge of COVID-19, there's both the direct infectious disease consequences, but also that second ring of effect, which is largely mental health. This pandemic has caused anxiety, stress related to getting the disease, work changes, life changes. So we designed a program at the department called Strengthen Me. It is designed based on what's called disaster behavioral health. There's a long history of looking at what happens when there is a crisis or trauma and how do we help people recover from that. Strengthen Me is free for Maine people. If anybody is interested in calling, our number is 221-8198. That's 207-221-8198. And we have resources tailored to different people, be it older Mainers who may be homebound to healthcare workers who may be struggling to stay on the job. We really have recognized the strain and stress of the pandemic is serious and hopefully have some resources that can help.
Great, thanks,
you. Rebecca. Yep, thank you. Let me go to Catherine from the Maine Wire next.
Good afternoon, Dr. Shah, and thank you for taking my question. The Maine CDC currently publicly provides COVID-19 hospitalization data by county and age for individuals who are under the age of 25. And I'm wondering if Maine CDC tracks that hospitalization data by age for individuals who are over 25 and whether you can provide it to the public.
Got it. We do, Catherine, but you're asking by the sort of zip code or granular level, which we do for the under 25. We do track it, at least insofar as when we identify a case and we investigate. One of the things we want to know is what their home zip code is, so we can keep track of those trends. But I don't know whether we've aggregated it in a manner that we could publish. I'll check with our epidemiology team. As you know, as you noted in your question, we do so for those under the age of 25, but for over the age of 25, I'll have to check. It's a good question.
Thank you.
Yep, thank you. Let me go to Sarah from the Chias Valley News Observer. Sarah, good to have you back.
Thank you. Thanks for taking my question. I will not go back to the EMMC one. I think or the Central Maine Medical Center one. I think I'll save that question for another day. But I did want to ask Commissioner Lambrou, in the past, you mentioned efforts to increase testing sites in rural counties like Washington County. I did see a press release come out not long after that. It didn't actually relate to Washington County, where we did already have all of our Walgreens in play. But I'm wondering if you can comment on the progress of that effort.
Yeah, and I will just note that while we did have all the Walgreens in play for the rapid antigen test by NextNow, we did add PCR testing, which is a different type of testing. So agree that it is not a new testing site, but there's additional testing that will be available at those Walgreens. All that said, we are working very aggressively. We're close to be able to talk about some new testing options in Washington County. We've been working with Eastport Health Clinic, who has been a great partner there, as well as some other partners in the county to figure out where are those gaps and what we could do about it. So we are hopeful that sooner than later, we can have some more news for additional testing options in Washington County.
Thank you.
Thank you.
Thanks, Sarah. Joe Waller, over to you.
Yes, hi. Good afternoon. On one topic here, just following up on the CMMC discussion, I was hoping that Commissioner Lambrou could be a little bit more specific about what types of regional resources are being contemplated to help out? I know other states have perhaps used National Guard to help, or maybe there's some other ways to help backfill while they're trying to hire new people.
Sure. And as a reminder, the way we do this is we do really close listening to see what those gaps are and why, to figure out, for example, if there's a gap in ICU nurses, what other types of nurses are trained that could be redeployed within the system, either Central Maine Medical Center or their 2 affiliated hospitals to help. Neonatology, if there's a neonatology nurse challenge, we have a chief clinical officer for children in the state of Maine, and she works on a perinatal system of care. Are there other resources we can tap into? What are the different levels of neonatal care in the state, and where are our gaps? We do that kind of very granular discussion with hospitals like Central Maine Healthcare to see what, if anything, we can supply. I know that the National Guard has been a tremendous partner throughout this pandemic, helping in certain circumstances. Last year, they helped with some of our nursing facilities that had serious outbreaks with workers out. They are helping with our vaccination efforts to this date. So we continue to, again, work one-on-one with facilities to figure out what are their gaps, how we potentially can help. That can include flexibilities. It can include volunteers from Maine Response. There's a whole array of supports that we have, including best practices, just kind of saying, this is what this different facility did. Would that work for you? So that is an ongoing effort with Central Maine, as well as any other facility, nursing facilities, as well as group homes, as well as hospitals that need that kind of help.
Joe, so just a quick clarification. So is the National Guard being considered to help with the Central Maine healthcare situation? And then I'll just go ahead and ask my last question right now for Dr. Shah, and that is, what is the backlog of cases this week, and is it similar to last, or are we looking at a large, several thousand cases of backlog to go through? Thanks.
Go ahead, you ask that, Joe. We'll get to that, but yeah.
Yep. And while I can't, the Department of Health and Human Services is not the organization that would field a request for the National Guard. I do not believe there has been one filed, but I would defer you to the Maine Emergency Medical Agency. Maine Emergency Management Agency.
Yeah.
Thank you.
And there, Joe, with respect to the Guard, if such a request were to be made, one of the things that's considered is the nature of the positions, medical versus non-medical, that are being requested. It's one of the many factors that are considered. There are some limited number of personnel, men and women within the National Guard, who do have medical training, but they work full-time elsewhere in the medical community. So they're coming on to duty necessarily then unfortunately creates a vacancy in another healthcare system. So that's part of the calculus. Of course, the National Guard would be the ultimate person to answer those questions, but that's part of the discussion that we've had with them throughout the pandemic, not just in connection here. In terms of the backlog, Joe, there is zero backlog. Happy to. There's no backlog. There's nothing awaiting review. We are within normal operations right now.
Thank you.
Yep. Let me go to Caitlyn Andrews next.
Hey, good afternoon, Dr. Shah and Commissioner Lambrou. Do you guys have a sense of the vaccination rates at dental practices and EMS workers?
Don't. Yeah.
We do not collect data on dental practices. Our survey got fielded back in June. In terms of EMS, my understanding is that the Department of Public Safety is working on a data collection effort. So I defer you to the EMS part of the Department of Public Safety.
Okay, can you talk a little bit about how compliance will that be the same for those practices as it is with these other facilities? How are you going to kind of tackle any differences there?
So I am going to say that we are currently operating under the emergency rule. There was a proposed rule that we anticipate finalizing in November that will address some of the comments that we've gotten during the public hearing and the public comment period. So it's a little premature to talk about what, if any, changes will be made in that final rule. but I refer you to the previous rule to talk about how it's been done in the past.
Okay, and my second kind of question is I'm still looking at some of the data on the staffing numbers in this dashboard, so I may want some clarification on how these numbers are gotten, but is there a sense of how much these vaccination rates have been influenced by staffing changes at these facilities?
What do you mean exactly, Caitlyn?
So I'm looking at some of the data within the dashboard that looks like the number of staff reported by these facilities overall. And it looks like there may have been some changes from August to September. And so I'm trying to get some clarification on like what this data shows and whether we think that may have had any influence on the vaccination rates we're seeing today.
Sure. So I'll just do a general comment, and maybe if there's a specific question about the data, we can get that answer to you offline. We're encouraged by the data. We're excited to see that in many facilities, there was a significant increase from June to July, but especially from August and September. We do anticipate that is because organizations that are going to be subject to this rule, took the extra time, the extra effort to talk to their staff, to give them opportunities to be vaccinated, to really work with them too. And you hear this all the time. Sometimes it's that one-on-one conversation that answers a question that had gone unanswered by that worker that makes a difference. So we are encouraged by what we see in the September survey. We hope that's even higher at the end of October. And we will continue to work with our healthcare facilities that have at their best, their interest is our interest, which is keeping their workers safe and keeping their patients and residents safe.
Thank you.
Thanks, Caitlin. And the last question for the afternoon goes to Patty White.
Thanks, Dr. Shah and Commissioner Lambrou. You've talked about what you're doing in anticipating staffing shortages, but with just a few days left for healthcare workers to get the vaccine in time to be fully vaccinated by the time the requirement is enforced, are there any new efforts you're making to kind of help encourage vaccinations? I know you've provided support along the way, but are you yourself having one-on-one conversations with any staff or anything new that you're doing to try to boost those numbers?
Dr. Shah, maybe you can go first and I can talk a little bit about other ideas.
Yeah, so Patty, we're continuing sort of the same degree of general public communication about the vaccine, the safety, the effectiveness. We have worked with facilities specifically that have had specific questions that have come up. I've done some webinars lately or Zoom chats with different groups to hear questions, try to answer them as best as I can. I've got another one coming up, I think tomorrow or Friday. So we're continuing all of those. I wouldn't say, Patty, I wouldn't characterize them as me talking one-on-one, but it's sort of me speaking with medical staff, more generally, maybe 10 to 50 people to take their questions, answer them directly. Some of that is in the run-up to this Friday, but some of it is just part and parcel of what we've been doing. I expect to continue doing that too.
Yep. I will just add that one thing that is new is, we do spend a lot of time talking and listening and working with our partners. Some of our long-term care partners, for example, have said, look, we have some workers that we're lining up to hire, but they're coming from out of state or places where vaccination is not as high. And so we are, for example, we revise our frequently asked questions. We will say to a facility that wants to hire somebody who's gotten that first shot, but may not be fully vaccinated, that is okay. During this kind of enforcement period, we're running up to the deadline. That's the kind of flexibility that we're willing to offer, that if an organization finds a worker who has gotten a first shot, but is willing to use PPE and test frequently while that person is becoming fully vaccinated, they don't have to be fully vaccinated on their first day of work. So that's one example of kind of a transitional flexibility in enforcement discretion that we are offering in response to our conversations with our partners, because they are committed to having their workforce be fully vaccinated. We're just trying to get from point A to point B.
Thank you.
Thanks, Patty. Wow, that was 15 questions. Okay. Commissioner, we are wrapped up, so I will turn it back over to you. I've got one or two more things at the end.
Sure. I will just say that we continue to see our volume of vaccination go up, partly due to boosters, but hopefully it's due to people who may be looking for that first dose. We continue to have fairly widespread availability of vaccine clinics throughout the state. So people interested in getting a COVID-19 vaccine can call 1-888-445-4111 or visit the Maine vaccine website to find out where you can get your shot.
And I just wanted to close again by noting what I mentioned at the top, which is to thank everyone. We are about 6 minutes away from our 200th hour of press briefings. And as Rebecca Stefanski noted, many folks who are joining us today, especially if you are still on, have been watching these since the very beginning. And I want to take a second to acknowledge that you have certainly been through a lot. Even whether you've been watching or not, the entire state of Maine has been through a lot. And I just wanted to take a second to acknowledge that as a state, as a community, we are still in this. Even though there may be some hopeful signs on the horizon, we're still in a situation where 160 plus people are hospitalized and there are still several hundred cases per day. There are changes coming that we'll be talking about. Boosters for those who receive Moderna and J&J, the potential arrival of the vaccine for those 5 to 11, to say nothing of new medications that might be very effective at treating COVID-19. So there's much more to come on the horizon. As we always do, we look forward to keeping everyone up to date with what we know and when we know it. But as always, we ask everyone to please be kind and take care of one another. We hope to be able to chat with you again soon. Take care, everyone.